Severe acute malnutrition (SAM) is directly or indirectly responsible for approximately 1 million deaths per year in children globally. Most deaths are due to infectious disease, and the risk of death from infection is sustained despite nutritional rehabilitation and apparent stability. Currently, children with SAM are treated according to standardized guidelines from the World Health Organization. However, here at our rural center in Kenya, we have previously identified a high rate of post-discharge mortality amongst children with SAM. In fact, in the most underweight children, this mortality is as high as 20%. Similar results have been reported elsewhere in Sub-Saharan Africa. We hypothesize that ongoing but undetected infections are a main cause of death in these children, and importantly, current diagnostic techniques are either not sensitive or specific enough, or are too expensive to be of great utility in resource-poor settings. In addition, clinical assessment fails to identify the children most at risk of death due to infection, post-treatment, and post-discharge. Here in Kilifi, Kenya, we now have the capacity to screen for host and pathogen proteins in patient samples. These proteins are used to define signatures of disease, and we then identify those with prognostic as well as diagnostic value. Our bold idea is to develop a point-of-care diagnostic kit based on multiple proteins in patients' sera that could quickly and accurately identify children with SAM who are susceptible to an increased risk of death due to infection and after apparent stabilization during and after treatment. This generic bedside test would allow targeted investigation and treatment that would be expected to halve subsequent mortality in this